so that you... Okay, so you can see my screen? Yep, good. So these are the people that we worked with, a good team of people with lived experience and family members. There were also some scientists on board that we worked with together to build these best practice guidelines. Disclosures, I'm funded by the Canadian Institutes of Health Research, the Center for Addiction and Mental Health, and the University of Toronto. No conflicts of interest to disclose. Susan.
So I think all of you are probably familiar with this, but when we talk about lived experience engagement, we know that it's a growing movement towards a new paradigm of research, including mental health and substance use research, where we look at patients and subjects as becoming colleagues, as advisors, collaborators, co-researchers on things like steering committees, advisory groups, working groups. People with lived experience and family. The acronym what we use is PWLE and F. And when we look at contributions, the idea is that people with lived experience advisors are part of the research team. And in our study, that means we were actively involved, including these contributions. So early engagement in priority setting, research questions, research design, in project planning and operations, participant-facing tools, recruitment strategies, research procedures, and troubleshooting. And then at the end of the project, interpreting findings, lay knowledge translation, and academic knowledge translation.
So there are different engagement frameworks out there that some of you are probably familiar with. We can look to Health Quality Ontario for their patient engagement framework. The Patient Engagement and Research Conceptual Framework by Clan Hamilton and his colleagues is a popular one to refer to. The UK has one. There's PCORI in the States, the Resource Center. There are various frameworks out there we can rely on. But what they have in common is most of them are looking at kind of high-level abstract thoughts, the importance of valuing people with lived experience. This is all very, very important. But what they're missing is the concrete to-do list. What am I actually supposed to do when I'm working in lived experience settings? So that's where we went, and we had the objective to co-design best practice guidelines for engagement in mental health and substance use health research. We wanted to include a wide spectrum of guidance. We want to start with these broad-based values that folks tend to agree on in engagement settings, but we wanted to move beyond that to provide some actual practice recommendations, some concrete to-dos to help people figure out how to do this work together. We did this using a SPORE-aligned Delphi study. So a Delphi study is basically multiple rounds of surveys where you send out a survey, get everyone to rate things, and then you do the analysis really quick. You revise the survey, you send it out again and again until you get to folks agreeing on a consensus. Method. So it's a modified Delphi survey. That means we started with initial items. It's modified because we started with a list of items rather than just asking them qualitatively. We recruited 61 participants. That was 26 researchers and about 35 people with lived experience and family, a little more lived experience than family, as we often see. We started with 56 items that we developed together. We started with the literature that we've been working on. We've done a couple of literature reviews on this topic. So we worked with the literature and we came together. We worked together with the lived experience and family working group, and we went through each item and refined them and added items and removed items and did some good work there together. But we didn't push it too far because we knew we were going to the Delphi and we wanted to leave some work for our participants to do. So we had 56 items, 5 category content map. We'll show you the categories in a minute. And we did 3 rounds of Delphi consultation. And our participants rated those 56 items on the importance of including them in the best practice guidelines and the clarity, both on a 7-point Likert scale. They also provided a bit of qualitative feedback, which helped us with the rewording. And you have to define consensus in a Delphi. So 70% of participants had to rate items as very important or essential for us to consider that that item had a consensus, and that was in our guidelines. Susan.
So, in terms of the engagement team, the people with lived experience in family, there were two on the grant application. It was a six-member working group, and our tasks included the initial item development, recruitment flyer, recruitment strategy, participant video co-development, which we'll show you that in a minute, discussion of each round's results, ongoing item refinement, manuscript and guideline review, and co-authorship. And as I mentioned, one of our tasks was the co-development of a video, and Lisa will bring that up. And in this, we talked about things like the study description, the questionnaire use, explanation of ratings, how the feedback was used, and then just the basics of using the survey platform. So we'll show you that video.
Right. So I'm going to open the video. You'll tell me if you can see it and hear it if I shared right. We did this because we've got lived experience and family participants in our study, and not everyone knows what a Delphi is, right? We're supposed to get rid of all the jargon and explain things in real life terms. So that was the goal behind this video. Now, can you see my screen? Can you see the video?
Yeah.
Yes? Okay. Next question. Can you hear the video?
Welcome to our survey. My name is Bora. I'm a research staff, and I'll be guiding you through our process today. With your help, we'll be developing guidelines for the engagement of people with lived experience in mental health and substance use research. Let's start with a description of the study. We are gathering opinions from experts like you to reach a consensus. Think of it as teamwork without the group meetings. We're using questionnaires instead. Now, let's discuss how our rating system works. Our survey items are made up of recommendations. You'll be asked to rate the importance and clarity of each one. If a recommendation is not at all important or clear, you give it a 1. If it is a bit important or clear, you give it a 2. And so on, up to 7 for essential or completely clear recommendations. Each recommendation also has a comment box where you can share any additional thoughts. We'll use your feedback to refine the recommendations and keep only the ones that participants agree are important and clear. Now, let's dive into our survey platform. This survey has navigation buttons at the bottom of each page. Next, previous, and submit. Click the next button to move forward. Use the previous button to move back. Once you've rated all the recommendations, click the submit button. If you run into any problems or have any questions, contact me, Bora. I'm here to help. Great news! You are now ready to begin the survey. Thank you for taking the time and putting in the effort to share your insights with us.
Whoops. Okay. Try to move back. There we go. So we got really good feedback on that video. That was Wura, my research analyst at the time. I think she did a really good job of bringing it together with the working group's feedback. And we didn't have anyone not understanding what they were supposed to do. Everything went really smoothly. And I think the video was one of the reasons we were able to achieve that. Nice and accessible. Now I'm going to talk for a bit about the results. You probably want to get to the items themselves, but we're going to run through the results that we got in our Delphi. So round 1, we had 61 participants. Their importance ratings ranged from 51 to 96, so some lower ones, but some very high ones. There was a mixed bag here. There was good feedback to work with. The clarity ratings ranged from 39 to 86, so much, much lower, and we had a lot of work to do on clarity. From these results, we deleted 4 items. We added 2 items, one on family-specific engagement considerations and one on culturally relevant engagement considerations. We merged 2 items, and we refined a massive 52 items out of our, or 55 items out of our 56 items, all but one we revised. They really pushed us on clarity. And we did all this revision together with the lived experience of family working group. That was the group that was responsible for making all these decisions and revisions. So then we revised it, we analyzed and revised real quick. We sent out the next round a month later. We got 60 participants, so almost everybody showed up again. Importance ratings around the same. Clarity ratings went up a bit, which was good news. We again determined 5 items needed to be deleted, 2 items needed to be merged again. We only revised 11 items this time, so it was still quite a few, but not as extensive, so we're getting there. And we didn't add any new items. Then we flipped the survey to them one more time. We got 60 participants again, so really good feedback, and we had a video on each one to introduce them to the next round and what they were doing. Importance ratings went up a bit. Clarity ratings were not so bad. We deleted 3 items at this last round, and we revised 9 items, and we ended up with a final 44 best practice guideline statements that we're presenting to you. We're not presenting all of them to you today, but we'll give you a snapshot of them today. So that's how the research went. The guidelines are on, as I said, a 5-category content map. So we've got one category that's reflecting on underlying values with 6 items. We've got a category on planning to engage people with lived experience, 12 items for that startup pre-engagement stage. We've got 7 items for onboarding, that critical stage where you're onboarding people with lived experience. 14 items for the concrete working with period, where you're actually doing the work. And then 5 more items at the end of the study for evaluating engagement and reporting on engagement. Note that we're saying lived experience engagement rather than lived experience and family engagement. It does include both, but this was the team's decision. The lived experience of family team felt that families were people with lived experience and they wanted them to be encompassed together. Different teams come up with different decisions on this, but that was the decision this time around. Now, Susan's going to walk you through some examples of the guidelines.
Okay, so we'll just go through a couple of the recommendations under each guideline. So as Lisa said, we've broken down the recommendations we developed into different sections. The first one being reflecting on underlying values. And in this section, it includes recommendations focusing on principles that teams are encouraged to examine and reflect upon to make an authentic and meaningful collaboration. So some of these are, I'll just read the 2 we've got here. Consider why you want to engage people with lived experience and how their expertise can be included in your project. So, we want this to be authentic. So you really have to consider that you're not involving people just for funding purposes, or really try and make it an authentic engagement. And then recognize that lived experience and research experience are different, but equally valuable, and both can inform a research project. So when I talk to patients and families that are getting involved in this kind of thing and are a little nervous because they're, with experts in the field, and I always tell them, you're an expert too, and you're a subject matter expert, and so we have to respect what each other brings to the room. So on the next slide, so this section, planning to engage people with lived experience. So these recommendations focus on the planning steps that research teams can work through before the start of a project. Some of these recommendations require a commitment to learning, and others focus more on concrete planning steps. So a couple examples: plan to start engaging people with lived experience as early as possible in the project, and ensure that the team's scientists, trainees, and research staff have appropriate training on how to engage meaningfully with people with lived experience. And that's part of what this project is about. To some people, they may be quite accustomed to working with people with lived experience, and others maybe not so much. So in this slide, we're talking about onboarding people with lived experience. which is a key step that prepares the team for the rest of the engagement experience, and it sets the stage for success. So a couple of these recommendations: engage more than one person with lived experience on each project to ensure that diverse experiences are heard, but also to provide an opportunity for them to support each other. So sometimes there's a real support network that can develop, which is important. And take the time to establish friendly rapport and build relationships with people with lived experience. And that might seem very obvious, but sometimes we have to just take a minute and really make sure we're focusing on that as well. So in the section Working with People with Lived Experience, we focus on the way research teams engage during the actual research process. So a couple of these recommendations: acknowledge and address unequal power between research and people with lived experience, for example, through training and by fostering a culture of respect. And that kind of goes back to what I was saying before, just recognizing that we all have our own areas of expertise. And ensure that people with lived experience have the time and opportunity to contribute in ways that are meaningful to them. So that might, include just checking in with people as the project goes along. Okay, so when we talk about evaluating and reporting lived experience engagement, we're nearing the end of the project, but still have engagement processes to keep in mind, such as reporting and evaluations. Some of these determine whether the extent of people with lived experience contributions make them eligible for manuscript co-authorship, invite them to co-author the manuscript if appropriate, and support them in this role. And this is something that was done in our paper. And when publishing, report accurately on what the role was of people with lived experience in your project. So those are just, there's a lot more, obviously. Those are just a few examples we developed. And I'll pass it back to Lisa.
I would add to this last slide, if you're interested in the information on this slide, I have more for you. My PhD student, Yasmin Shikan, did her dissertation on this very topic, and she produced a reporting guideline for things to follow when reporting on lived experience engagement in research that is quite reflective, and you do it together with your lived experience partners to get a nice reporting. And she also came up with some preliminary guidelines around how to go about co-authorship in lived experience teams. So I can share that with you. There's a manuscript and a guideline document. If you're interested in that, I'd be happy to share that with you so you can learn a little more. And then I will leave the QR codes up for a minute. You can download the paper. We have the guidelines available in both English and French. And I'm happy to share them by email. Feel free to reach out. And I have some questions for you. That's wrapping up what we have to say, but I have some questions for you. Of course, we're open to answering any kind of questions you might have, but let's think about a few of these things. What are some other practices that you consider best practices? We only showed you a few. Do you have some other items that maybe we have, maybe we don't? What are the benefits of applying best practices? How do you think this would help with engagement settings? And how can we together get these best practice guidelines implemented in common practice? We've done quite a few things to try to push them out there and get them into people's hands. What else can we do to encourage implementation? We know implementation is such a hard thing in health sciences research. Happy to have any ideas you might have on that. I'm going to stop sharing my screen so we can have a discussion, and I'm going to pop these questions into the chat. If I can figure out how to do that.